Hi everyone. If you are taking amlodipine, losartan, or lisinopril, can I ask you something right away? When was the last time you thought about how the medicine was making you feel, not just what your blood pressure number was? Because a lot of people get told, your pressure looks better, great, keep taking it, and they never stop to ask whether their body is whispering that something is off. And those whispers are easy to miss because they often look ordinary. They look like swelling. They look like fatigue. They look like a weird cough. They look like getting dizzy when you stand up. And most people blame age, stress, bad sleep, the weather, or just a busy life. My name is Dr. Andrea Patrick, and for years I have had the privilege of helping people manage high blood pressure and the consequences of not managing it well. And one thing I can tell you is this: blood pressure medicine can be life-saving, absolutely life-saving, but only if you understand what it is doing for you and what it might be doing to you. Because the goal is not just to lower a number on a screen. The goal is to help you protect your brain, your heart, your kidneys, your blood vessels, and your future, without quietly suffering through side effects that nobody ever took the time to explain to you. So in this video, I am going to show you the 7 side effects you must know if you are taking amlodipine, losartan, or lisinopril. And I want to do this in plain language because these 3 medicines are common, but they are not identical. Amlodipine relaxes blood vessels in one way. Losartan relaxes them in another way. Lisinopril works through yet another pathway. And that means the side effects can overlap, but some of them are much more likely with one medicine than another. And if you understand the pattern, you are way less likely to ignore something important, and way more likely to know when it is a nuisance, when it needs a phone call, and when it is an emergency. First, though, you need one simple frame in your mind. If you are on amlodipine, that is often paired with either losartan or lisinopril. That part is common. But losartan and lisinopril together? That is not a routine combination for most people. And it is not something you should ever add or continue casually without a very clear reason from the clinician managing your case. Why? Because when you start stacking certain blood pressure pathways, you can increase the risk of potassium problems, kidney trouble, and blood pressure dropping too low. And that matters because sometimes a side effect is not random at all. Sometimes it is the body telling you the combination is too much. The second thing I want you to understand is that medication side effects rarely announce themselves dramatically at first. They do not walk into the room with a giant sign that says, "Hello, I am from your prescription bottle." No, they sneak in dressed like everyday life. You feel more tired. Your shoes get tighter at night. You cough. And you think maybe it is allergies. You stand up and feel a little floaty, and you tell yourself you just got up too fast. Your legs feel heavy. Your pulse feels weird. Your appetite shifts. You feel off. And the longer that goes on, the more your brain accepts it as your new normal. That is exactly why I wanted to make this video. So let us go through these 7 side effects the way I would explain them to a friend or to a patient sitting in front of me in clinic. And I want you to listen for your own story. Not so you can panic, not so you can stop your medicine on your own, but so you can recognize patterns early and have a smarter conversation with your doctor or pharmacist. Because good medicine is not just prescribing. It is noticing. It is checking. It is adjusting. And if you have ever felt dismissed with, "Oh, that is probably just aging," I want you to know that sometimes aging gets blamed for things that are actually coming straight out of the pill organizer. Number 1, swelling in the ankles, feet, or lower legs. This is probably one of the most commonly missed side effects, especially with amlodipine. And what makes it tricky is that people often assume swelling means they ate too much salt, or they were sitting too long, or they are just getting older, or maybe it is the summer heat. But if you started amlodipine or your dose went up, And now, by the end of the day, your socks are leaving deep marks, your shoes feel tighter, or your ankles look puffier than they used to. I want that medicine to cross your mind. Because for a lot of people, the medicine is the reason. Not the only possible reason, of course, but a very common one. And here is why it happens. Amlodipine relaxes arteries very well, which is one reason it lowers blood pressure nicely. But it does not relax the veins to the same degree. So blood moves into the tiny vessels in the legs, the pressure shifts, fluid leaks out into the surrounding tissues, and now you get that classic ankle or foot swelling. What is interesting is that this swelling is not always because your body is retaining tons of extra fluid the way people imagine. Sometimes it is more of a fluid shift than a true total body water overload. That matters because people often try to fix it the wrong way, or they just live with it when the dose or the medication may need adjusting. I had more than one patient tell me, "Doctor, I thought I was gaining fat around my ankles," or "I thought maybe my circulation was just getting bad." And then we traced the timeline, and the swelling started right after the prescription changed. That is why timing matters so much. If the swelling is mild, some people can manage by elevating their legs when sitting, walking more throughout the day, reducing excess sodium, and discussing dose changes with their clinician. But if the swelling is significant, or one leg is much worse than the other, or it comes with chest discomfort or shortness of breath, do not assume it is just the amlodipine. That needs real evaluation. The key message here is this: swelling is data. It is not vanity. It is not you being dramatic. It is your body showing you that pressure dynamics inside your blood vessels have changed. And the reason I spend time on this one is because people normalize it for months, even years. And then they start moving less because their legs feel heavy, their shoes feel uncomfortable, they stop walking as much, and now the very medicine helping their pressure is indirectly hurting their daily activity. So if you are on amlodipine and your ankles are changing, pay attention, especially if that swelling started after starting the medicine or after a dose increase. Number 2, dizziness, lightheadedness, or feeling like you might faint. Now let me tell you about the side effect that people love to brush off with one sentence. I just stood up too fast. Maybe. Sometimes that is true, but if you are taking amlodipine, losartan, or lisinopril, and you notice you are getting dizzy when you rise from bed, when you stand from a chair, after a hot shower, after a long walk, or when you have not eaten or hydrated well, then low blood pressure or a blood pressure shift needs to be on your radar. Because what these medicines are supposed to do is lower pressure. And sometimes, especially after starting, increasing the dose, getting dehydrated, or being sick, they can lower it too much for your body in that moment. This is especially common when somebody says, "My doctor put me on blood pressure medicine, but I also started eating better. I lost weight. I stopped drinking as much alcohol. I am walking more, and now I feel strange." Well, that is a wonderful problem to have, but it is still a problem if nobody adjusts the dose. Because the medicine dose that fit your old body may not fit the newer, healthier version of you. Or maybe you got a stomach bug, had diarrhea, were not drinking enough, and then took your usual pill on top of that. Your blood volume drops, the medicine still relaxes the vessels, and suddenly you feel washed out, shaky, faint, or like your vision grays for a second when you stand. And this is where I really want you to listen carefully. Dizziness is not always harmless. If it is mild and brief, maybe it is simply a signal to sit first before standing, hydrate, and check your pressure. But if you are nearly fainting, actually fainting, feeling confused, having chest pain, or you are too weak to function, that is different. That is no longer, "Oh, I just moved too quickly." And older adults are especially vulnerable here because low blood pressure is not only uncomfortable, it raises the risk of falling. So now a side effect becomes a broken hip, a head injury, a trip to the emergency room. This is why I never call dizziness nothing. One very practical thing you can do is measure your blood pressure when you feel fine, and again when these symptoms happen. And if possible, check it sitting and then standing after a minute or two. Not because you need to play doctor at home, but because patterns matter. If your pressure is running too low for you, or dropping sharply when you stand, that is useful information. And by the way, if you are having vomiting, diarrhea, fever, not drinking enough, or sweating heavily in hot weather, those are the times to be extra cautious and call for guidance. Because blood pressure medicine that felt perfect on a normal day can feel very different when your body is dried out. Number 3. A dry cough that just will not go away. This side effect has a personality. It is usually not a wet cough. It is not the classic phlegmy cough of a chest infection. It is the cough people describe as a tickle, a scratch, a dry hacking irritation, something that seems to live in the back of the throat. And if you are hearing that description and thinking, that sounds familiar, I want your eyes to go straight to lisinopril. Because among the 3 medicines in this video, lisinopril is the one most famous for this. Not everybody gets it. Many people never do. But for those who do, it can be incredibly annoying, especially because it often shows up in a way that looks unrelated at first. People will say, I thought it was allergies. I thought it was reflux. I thought I had a little cold that never left. I thought the heat kicked on and dried my throat out. And again, sometimes those guesses are right. But if the cough began after starting lisinopril or after being on it for a little while, do not ignore that connection. One of the interesting things about lisinopril cough is that it can show up fairly soon, but it can also appear later than people expect. And because it is not dangerous in the way angioedema is dangerous, people tolerate it and tolerate it and tolerate it until it starts disturbing sleep, conversation, exercise, and quality of life. The reason this happens is that ACE inhibitors like lisinopril affect certain chemical messengers, including bradykinin, and in some people that seems to irritate the airways and trigger this persistent dry cough. Now that does not mean every cough on lisinopril is from the drug. Absolutely not. Cough can be caused by asthma, reflux, allergies, infection, smoking, lung disease, even heart failure. This is why I do not want you self-diagnosing from YouTube alone. But I do want you thinking clearly. If the cough is dry, persistent, and started after lisinopril, talk to your clinician. Because sometimes switching from lisinopril to an ARB like losartan solves the problem beautifully. And that is what frustrates me when people are told, oh, just live with it. No. If the medicine is doing a good job, but the side effect is dragging down your life, there may be another option in the same treatment universe that your body tolerates better. You do not get a gold medal for suffering through a side effect that has a reasonable alternative. But please hear me on this. Do not stop prescribed blood pressure medicine abruptly on your own just because you suspect a cough. Get it assessed. Because sometimes the cough is the medicine, sometimes it is something else, and sometimes it is both. Medicine is personal, and you deserve an actual conversation, not a shrug. Number 4, potassium going too high. This is one of the most important side effects in the whole video, and one of the most dangerous because it can be mostly silent until it is not. Losartan and lisinopril can both raise potassium, especially in people with kidney disease, dehydration, diabetes, older age, certain other medications, or when somebody is also using potassium supplements or salt substitutes that contain potassium. And I need to pause there because a lot of people are trying to be healthy. They hear, lower sodium, use a salt substitute, and they do not realize some of those products swap sodium for potassium. Now the intention is good, but the chemistry can become a problem. Why does high potassium matter? Because potassium affects the electrical function of muscles and, most importantly, the heart. When potassium rises too much, some people feel nothing at all. Others may notice weakness, unusual fatigue, tingling, heaviness, or a strange sense that their heart is not beating normally. They may get palpitations, they may feel fluttering, they may feel off, and in more serious cases, dangerous rhythm problems can happen. That is exactly why blood tests matter so much when you are on medicines like losartan and lisinopril. Sometimes the body does not give you a dramatic warning. The lab is the warning. And I want to say something very clearly here. If you are taking lisinopril and losartan together, potassium becomes an even bigger conversation. Not because it guarantees harm, but because you are stacking two systems that can both push potassium upward and affect kidney blood flow. Again, there are unusual cases where a specialist may do something more complex for a very specific reason, but this is not a casual DIY combination. And you also have to watch the hidden helpers that can worsen the issue. Potassium supplements, heart-healthy salt substitutes, certain water pills like spironolactone, some pain medicines, dehydration, and kidney impairment. All of these pieces can team up quietly. So what should you do? First, know whether your doctor is checking your potassium and kidney function after starting or adjusting one of these medicines. Second, review your supplement shelf. Do not assume electrolyte means harmless. Do not assume salt-free means universally safe. And third, pay attention if you develop new weakness, unusual fatigue, muscle symptoms, or palpitations, especially if your labs have not been checked in a while. This side effect is one reason I tell people your blood pressure medication is not just about the number in your arm cuff. It is also about what is happening in your chemistry. The pressure may look better while the potassium is quietly drifting the wrong way. Number 5. Kidney strain or a sudden drop in kidney function. Now this one confuses people because losartan and lisinopril are medicines that can actually help protect the kidneys in the long run for the right patient, especially in certain kidney conditions and diabetes. So then people hear, wait, doctor, are you saying the medicine helps the kidneys or harms the kidneys? And the honest answer is, sometimes both statements can be true depending on the context. These medicines change pressure dynamics inside the kidney filters. That is part of how they can be protective over time. But under certain conditions, especially dehydration or already compromised kidney blood flow, that same shift can stress the kidneys too much. This is why somebody can start one of these medicines and then their doctor wants labs after a few weeks. That is not the doctor being picky. That is the doctor doing good medicine. Because a small change in kidney numbers can be expected, but a big change is a different story. And the people at higher risk are often the ones who are volume depleted, taking certain diuretics, using NSAIDs like ibuprofen or naproxen regularly, dealing with vomiting or diarrhea, or already living with chronic kidney disease, heart failure, or narrowed kidney arteries. When several of those factors line up together, the kidneys can take a hit. And here is the problem in real life. People do not think, I might be headed toward an acute kidney injury. They think, I feel tired, I am peeing less, my appetite is off, maybe I have some low back discomfort, maybe I just feel dry and weird, or they do not feel much at all. Then the lab comes back and suddenly everybody is talking about creatinine and eGFR, and the patient feels blindsided because nobody explained this possibility ahead of time. That is why I am explaining it to you now, not to scare you, but to help you connect the dots when you are sick, dehydrated, overusing pain relievers, or combining medicines that can all squeeze the kidneys at once. Number 6. Swelling of the lips, tongue, face, or throat. This is the side effect I never, ever want you to ignore. It is called angioedema, and it is especially associated with lisinopril, though it can rarely occur with drugs like losartan too. And what makes it so dangerous is how quickly it can turn from weird to terrifying. It may start as lip swelling. Maybe your tongue feels larger. Maybe your voice changes. Maybe swallowing feels strange. Maybe your throat feels tight. Maybe you develop facial swelling that is clearly not normal. If you are hearing those words and thinking, that sounds dramatic, yes, it is. Because when the mouth, tongue, or airway are involved, we are not talking about a cosmetic problem. We are talking about a breathing problem. What is important to know is that angioedema does not always happen on day one. A lot of people think dangerous drug reactions only happen immediately, but that is not how the human body always behaves. It can happen early, yes. It can also happen later than people expect. And because most people taking lisinopril never experience it, those who do are completely caught off guard. They do not think, this could be from my blood pressure medicine. They think, am I having an allergy? Did I eat something? Is this a bee sting? And while they are wondering, time is passing. This is one of the rare moments where I will tell you very directly, do not sit around and contemplate. If you have swelling of the lips, tongue, face, or throat, especially with trouble breathing, trouble swallowing, hoarseness, or a feeling that your airway is changing, seek emergency help immediately. This is not the time for a wait-and-see experiment. And yes, for a routine nuisance side effect like mild swelling in the ankles, you call your doctor. But for angioedema-type swelling in the face or mouth, especially if breathing or swallowing is involved, you go get urgent care now. That distinction matters, because the body region matters. Swollen ankles are one conversation. Swollen tongue is a completely different conversation. And I also want to mention something gently, but clearly. Certain groups appear to have a higher risk of angioedema with ACE inhibitors like lisinopril, and not everyone gets warned about that. So, awareness matters. But regardless of background, the rule is the same. If the swelling is in the lips, tongue, or throat, do not minimize it, and do not let anybody around you minimize it. This is one of those side effects where being calm is not the goal. Being fast is the goal. And if you have had this reaction before, that absolutely needs to be part of every future medication conversation, because repeating the same mistake is how avoidable emergencies happen. Number 7, pounding heartbeat, chest discomfort, flushing, or unusual shortness of breath. Now, this last category is important because it sits in that annoying space between maybe this is nothing and maybe this is serious, and people often do not know how to sort it out. Amlodipine in particular can cause palpitations, flushing, headache, and a sense that your heartbeat is suddenly more noticeable. Some people describe it as pounding. Others say their chest feels warm. Others say they feel their pulse in their neck or ears. Sometimes it is brief and harmless. Sometimes it fades as the body adjusts. But it is still worth respecting because the cardiovascular system is not an area where I love guessing. And here is why I want you to be especially thoughtful. When a medicine opens blood vessels, your body can respond in ways you notice. Maybe your face feels warm and red. Maybe your heart rate seems to pick up a little. Maybe you feel more aware of your heartbeat when you lie down. That can happen. But there is a line. If you develop real chest pain, worsening pressure, significant shortness of breath, or symptoms that feel wrong in a deeper way, do not lazily file that under side effect. Because while rare, there are situations where chest pain worsens after starting or increasing certain blood pressure medicines, especially in people who already have significant heart disease. This is where your body's context matters. If somebody says, I started amlodipine and now my ankles are mildly puffy and I get a warm face sometimes, that is one conversation. If somebody says, I started a higher dose and now I have chest pain walking to the mailbox. That is a different conversation entirely. The first may be an expected side effect. The second needs medical evaluation. And if you are getting palpitations alongside weakness, dizziness, or a sense of your rhythm is not right, then we are also thinking about blood pressure shifts, potassium issues, or other things that deserve attention. This is why I teach people not only to know the list, but to know the pattern and the severity. How to tell whether it is the medicine or something else. So now the question becomes, doctor, how do I actually sort this out in real life? And here is my simple answer. Timing, patterns, and measurements. Timing means when did the symptoms start relative to when the medicine started or changed. Patterns means, does it happen after each dose, at a certain time of day, when you stand, after salty meals, when you are dehydrated, after exercise, or when you lie down? Measurements means, what does your blood pressure say? What does your heart rate say? What do your labs say? Because symptoms without patterns are confusing. Symptoms with patterns are information. For example, if your cough began a couple of weeks after lisinopril and everything else looks fine, that is a pretty different story than a cough with fever and mucus. If your ankle swelling worsens after starting amlodipine and is worst by evening, that points one direction. If you are on losartan, using a potassium salt substitute, your labs have not been checked, and now you feel weak and your heart is fluttering, that points another direction. If you had vomiting for 2 days, kept taking lisinopril, and now feel dizzy and barely pee, that points yet another way. The point is not to diagnose yourself with certainty. The point is to stop being blind to the pattern, and while you are at it, keep a very simple log, not a complicated diary that you will abandon in 2 days. I mean something basic. Date, medicine and dose, blood pressure, pulse, symptom. Note whether you were sick, dehydrated, or using things like ibuprofen or potassium supplements. That is it. Because sometimes the reason people feel unheard is not that nobody cares, it is that the pattern was never visible. But when a patient comes in and says, every afternoon after this dose my ankles swell, or every morning since starting lisinopril I have this dry cough, or here are 3 blood pressure readings when I got dizzy, now we can work with something real. Please do not do the thing I see all the time, which is this. You feel a side effect, you get frustrated, and then you start taking the medicine randomly. Every other day, half a pill some days, skipping when you feel fine, doubling when the number looks higher. No, that is how you create chaos. Blood pressure medicine works best when taken consistently and adjusted thoughtfully. Inconsistent dosing can make both your pressure and your symptoms harder to interpret. And it can also make you conclude the medicine is awful, when what is really awful is the unpredictability you unintentionally created by taking it differently every day. If you forget everything else in this video, remember this quick map. Amlodipine. Think swelling, flushing, headache, palpitations, and sometimes dizziness. Lisinopril. Think dry cough, dizziness, kidney function changes, high potassium, and the rare but dangerous angioedema. Losartan. Think dizziness, kidney monitoring, high potassium, and rare swelling or rhythm-related concerns. And for both losartan and lisinopril, think carefully about dehydration, NSAIDs, supplements, and lab monitoring. That little mental map will help you notice patterns much faster than if all blood pressure medicines just blur together in your mind as my pressure pill. So friends, here are the 7 side effects again. 1. Ankle or leg swelling. 2. Dizziness or feeling faint. 3. A dry cough that will not quit. 4. Potassium going too high. 5. Kidney strain or worsening kidney function. 6. Swelling of the lips, tongue, face, or throat. 7. pounding heartbeat, chest discomfort, flushing, or unusual shortness of breath. And I want you to notice something. Some of these are annoying, some are important, and some are emergencies. Your power is not in memorizing every rare detail. Your power is in recognizing which category you are in and responding appropriately instead of ignoring it. If this video helped you, I want you to do one simple thing today. Check your medication list, check your latest blood pressure reading, and think honestly about how you have been feeling since you started your medicine. Not fearfully, honestly. If something in this video sounded familiar, write it down and bring it to your next appointment. And if you know someone taking amlodipine, losartan, or lisinopril who keeps saying, "Oh, I am probably just tired because I am getting older," send them this video. Because sometimes one useful conversation can prevent months of confusion, and sometimes it can prevent something far more serious.